Dr. Rajiv has explained. One is patient is brain dead. That means brain is totally gone, but the heart will be functioning. So that most of the cases after assessment in a healthy person, young person, associated heart is sometimes heart will hole. If the hole is there, we will close, correct it, and the heart can be used in a younger patient. So that is one thing. Other thing is, as he mentioned in Sydney only, first time it was done in 2015. That is, if somebody is brain dead, but the heart is still beating. Heart will beat, oxygen is going into the lungs, still he is breathing spontaneously. In the end, the heart will just stop. So those type of heart, that machine is there when it supplies oxygenated blood into the heart. So adile keep giving blood and see how the heart is performing. Some heart may not be usable in these type of hearts where the heart stops by itself and resuscitates the heart. But few of them are usable. So we can get more donors. Because in India on the brain dead only we are using them. If they can get this also passed medically legally, then we will get more donors. But we need machines to transport, and the machine you can transport for longer distances and maybe few hours the heart will withstand because blood supply is going into the heart. Whereas at the moment what we are doing is stopping the heart and then transporting it to the nearest place by air and then green corridor. Up to 3-4 hours the heart is stopped already. Other machines probably we will be getting it soon. I think, is it available here?
No, sir, it's not available.
Not available. So they put this on the machine and supply blood to the heart will keep on beating because it is like normal. Oxygenated blood is going into the coronary artery supplying the heart and the muscle. So it will withstand hours of transportation without any problem because the distances, especially I was talking to somebody in the US, so from California to New York they can transport the heart. Because the whole country, they have only one system. Wherever who is listed in priority, whichever may be the state, the heart will be transported. So effective is the system there. Because people are, so many patients are, whatever artificial resuscitative measures like artificial implantation of artificial heart inside, all those things, artificial pumps inside the heart. Adukella side effect is there because anticoagulants, battery to be connected from outside. The best treatment of heart failure today is heart transplantation. Because all other things have its own problems. If our artificial heart left ventricular assist device that is expensive. It may cost 50-75 lakhs. The battery has to be connected outside to work. The patient has to carry the infection blood thinning tablets. So it's sort of there are people living like that, but it's not, especially in our situation, it is not as good as the results in other countries because they are very well organized. In the transplant is separate department just to look after the patients, separate cardiologists are there visiting different hospitals, patients are stationed, follow up. We don't have at present that sort of facilities in our country. So we are doing with the limited facilities what we can do. What is ideal is not practicable. If you wait for an ideal situation, we will never do anything in this country. So we have to modify things and make sure we do things almost the same level in the rest of the world. So finance, insurance, all these are big problems.
After transplantation, can the patient lead a normal life?
Absolutely. Important, that is the important thing now. See if a patient is taking enough medicines, tests are done properly. They can, because these medicines also are expensive. What happens is unless they can afford to take this medicine, doing a transplant sometimes may not be a good thing also. If they cannot afford, suddenly their longevity is less. That is why the people living after transplant, taken care of, they can lead a normal life, 20 years, 15 years. A lot of people living, doing all normal, even mountaineering, playing tennis, all those people are doing.
Sir, any age limit is there?
Age limit as such, it's 65, you know, 65 or?
See, that depends. Like most probably, we prefer taking donors up to 40 years, but beyond 40 years, then we have to assess them further. Up to 50 and 55, we do take.
You are talking about recipient or donor?
Donors. That's what it.
I don't know. Yes.
Oh, recipient.
Yeah, must be.
Recipient.
You are asking about recipient or donor?
Donor.
Donor.
We don't go ahead with old donors because they might have associated cardiac disease. So we usually prefer young donors, preferably less than 40 years.
Dr. Rajiv?
Yes.
What is the rejection rate of the transplant in India and whole world?
So the rejection rate is up to 5 to 8%, if I'm right, for the DBD donors, for the brain dead donors, and it's almost the same in India. The main cause for rejection is the adherence to the medications that the patient are taking. So if they're adherent, they're compliant, then they can survive for a longer period of time without rejection. So if you're talking about immediate rejection, it's just about 5 to 8%.
Sir, how long period does the patient need to meditate?
I didn't get your question, sir.
Patient, how long period he needs the meditation?
Medications. So it's lifelong. He is on an immunosuppressant which reduces the immunity so that the chance for rejection of the donor heart is less. We are reducing his immunity so that he doesn't develop antibodies against the donor heart. So it's a lifelong treatment. Yeah.
Sir, the organ எவ்வளவு நேரம் டிராவல் ஆச்சு சார்? எவ்வளவு நேரத்துல 4 ஹவர்ஸ்ல ஆபரேட் பண்ணிட்டீங்க? கொண்டு வந்தது எவ்வளவு நேரம்? எப்படி கொண்டு வந்தீங்க?
It's within 20 minutes by road.
எங்க இருந்து எங்க?
So any special permission வாங்கிருந்தீங்களா அதுக்கு கொண்டு வரதுக்கு?
No, we didn't ask for any permission. It was done in the early morning, so we had we had no issues.
Traffic
No. Like it was early in the morning, so we didn't have any
From where you are to this
You're not supposed to.
It's just private hospital there, within Chennai.
Within Chennai, we are for confidentiality of the donor, we are not supposed to medically tell you where and whose body heart has been. It has been in the city of Chennai only. So we didn't ask for a green channel because the police were willing to give us because it is. I mean, I must tell you that Tamil Nadu is the most organized sector in organ transplant. So we should be all proud of that because.
பரம்பரையா வருது அது எப்படி அவங்க அப்போ சின்ன வயசுலயே கண்டுபிடிச்சு
cardiomyopathy.
Cardiomyopathy, see, cardiomyopathy could be primarily muscle weakness thaniya varala. So many varieties are there. Heart muscle ரொம்ப hypertrophy hypertrophic cardiomyopathy வேற ஒரு விஷயம். That is all genetically acquired only. அப்புறம் வந்து severe valve heart disease வந்துட்டு operation பண்ற patient, they go into heart failure. No way we can treat with the medicine. Heart attack வந்துட்டு bypass பண்ண patient heart failure வரலாம். Young patients like 50-year-old, multiple blocks, stenting, 2-3 heart operations, patient persistent heart failure, we do transplant. Then children with complicated heart problem by birth, they also undergo operations initially because this is the last resort. Heart transplantation, everybody thinking if you put a new heart, everything is fine. It's not like that. As we are telling about the problems related to taking medicines, taking tests and all those things. So we try all the measures because if heart failure, medicines, advanced treatments are there medically, a lot of them can manage. When the patient is not able to carry out his normal activities with the optimal medications, maximum medicine, effective only we have to face transplant. It is so there are many indications. Other than this cardiomyopathy is one of them.
Sir, heart transplant சேரும்போது திடீர்னு cardio arrest ஆகுது. அதனால பேஷண்ட்ஸ்க்கு ஏதாவது ப்ராப்ளம் நீங்க ஏதாவது challenges ஃபேஸ் பண்ணீங்க?
இல்ல ஹார்ட் எடுக்கும்போது we support the body with heart lung machine. இப்போ ஒரு ஹார்ட் டிரான்ஸ்பிளான்ட் பண்ண பேஷண்ட் டோனர் ஹார்ட் கிடைச்சு எல்லாம் கிளியர் ஆய பிறகு we put the patient on heart lung machine. அப்போ heart and lungs we stop. So the function of the body is taken by the heart lung machine. Then we connect the donor heart to the recipient like in the video he showed. And then give blood to this heart, heart will take over, will disconnect the heart lung machine. அப்படிதான் work பண்றது. Because heart எடுக்கும்போது he has to be alive, no? At the end of the operation, otherwise patient will be brain dead. All the organs will go. So once we make sure, okay, the donor heart is good, the heart is going to come, say X amount of time, on the way there is no problem, then only we wheel the patient inside, open the chest, put the patient in the heart lung machine, remove the heart and put it. So that is what the importance of transplant coordination. They are very important part of this team. We are all in a WhatsApp group. Okay, heart is stopped.
What's the duration, sir?
Only I think we every 20 minutes.
Explant to implant was around 4.5 hours.
No,
No.
The surgery as such was within 1 hour.
Yeah, within an hour we finished. See, to do this operation, the first time we do the operation is when we do much more complex operations than heart transplant. Technically, it is of course difficult operation, but I won't say it is very, very complicated, especially when you are doing like a patient who had already had a heart operation, doing a transplant is a little more difficult. When somebody like this boy who comes, usually we finish stitching in about half an hour to 45 minutes. Actual time to stitch the heart will be 45 minutes in experienced hands. And then we will have to support the heart. Sometimes, but transplant you give blood to the heart may not pick up by itself immediately. So, heart lung machine, the first heart transplant we did, I had to support the patient in another hospital where I was there before. Support the heart for 3 hours. I thought the heart will not pick up. Adillana, heart lung machine, we have got other supporting measures. We can support it for days. Some patients, especially heart, lung, and transplant, we is called ECMO, which was put for our previous chief minister. She was put on the ECMO support. That is our life support. It is. You can put for 2 weeks, 3 weeks, 1 month, no problem. Heart may recover. So all those support systems are unfortunately. In our setup, all of this comes with a price. It's all expensive measures. Everything is available, we have. So one has to, spend a lot of money for all these things. That is the only thing, because we don't have health insurance to a large level. These are all, we can't predict. When you accept a patient, we can't predict, okay, X amount of time, X amount of money it will be over. No. If you are lucky, everything goes well, everything is fine. Then yes.
We will give a request to the government how it is treated in other countries. We will request the central government and state government to give the permission. What they explain, we will try to get it. Not only that, and our team, all our group, our doctors, actually I have to appreciate them on this junction, not the management alone. They themselves are having the international views and ideas and exposure to serve the nation and the public. I have to appreciate and congratulate the entire team of SIMS Hospital. Act on their own, because it being a hospital, everybody has their own responsibility. அதனால அவங்க என்ன பண்ணணுமோ அந்த ப்ரொசீஜரை இமீடியட்டாக அவங்க பாட்டுக்கு டீல் பண்ணுவாங்க. ஏதாவது ஒரு அப்நார்மல்னா தான் நம்மக்கிட்ட வருவாங்க. ஃபஸ்ட்டு செகண்ட் கிடையாது. Because daily ERல patient இருப்பாங்க, நிறைய விஷயங்கள் நடந்துட்டு இருக்கும். They are all responsibility.
சார், இப்போ இந்த உடல் உறுப்புகள்லாம் வேணும்னா பதிவு பண்றது, இந்த டிரான்ஸ்பிளான்ட்லாம் எப்படி கவர்மெண்ட்ல செயல்படுதுன்னு நினைக்கிறீங்க? எல்லாருமே பிரைவேட்டுக்கு வர முடியாது. இப்போ காஸ்ட்லாம் எவ்வளோ ஹைக்கா இருக்கும்னு நினைக்கிறது. கவர்மெண்ட்ல வந்து இது ஈஸியாக கிடைக்கணும், என்னெல்லாம் பண்ணணும், இந்த டிரான்ஸ்பிளான்ட் எப்படி டெவலப் பண்ணணும்னு நினைக்கிறீங்க சார்?
இப்போ வந்து கவர்மெண்ட்ல சர்டன் ப்ரொசீஜர்ஸ் டாக்டர் சொன்ன மாதிரி நம்ம தமிழ்நாடு ரொம்ப ஸ்ட்ரிக்டா இருக்காங்க. ஸ்ட்ரிக்டா இருக்கிறது தப்பு இல்லை. அதே சமயம் நிறைய தேவைகள் இருக்கு. சயின்ஸ் அண்ட் டெக்னாலஜி டெய்லி வளர்ந்துட்டு இருக்கு. ப்ராப்பரா நம்ம சோஷியல் ரெஸ்பான்சிபிலிட்டியோட, ஏன்னா நிறைய இடத்துல மிஸ்யூஸும் பண்றாங்க. அது இல்லாமல் நம்ம வந்து டிரான்ஸ்பிளான்ட்டுக்கு ஃபுல் பர்மிஷன் கொடுக்கணுங்கிறது என்னுடைய கருத்து. இன்சூரன்ஸும் அதே மாதிரி பார்த்தா நிறைய பேர் சொல்றாங்க இப்போ வந்து இவ்வளவுதான் வேல்யூ, அவ்வளோ வேல்யூன்னு. அதை வந்து இன்னும் இன்க்ரீஸ் பண்ணலாம். பப்ளிக்கு அவங்க வேணுங்கிற மாதிரி இன்சூரன்ஸ் எடுத்துக்கிறதுக்கு பாலிசிஸை பெருசு பண்ணணுன்றது என்னுடைய கருத்தும் ஐடியா.
சார், இப்போ இது 20 மினிட்ஸ்ல இதை கொண்டு வந்து நம்ம பண்ணியிருக்கோம். இன்ஃப்ராஸ்ட்ரக்சர்லாம் நம்மக்கிட்ட நீங்க முன்கூட்டியே இருந்ததா இல்லை இப்போதான் நம்ம
இல்லை நமக்கு எப்பவுமே அந்த மாதிரி இன்ஃப்ராஸ்ட்ரக்சர் எல்லாத்துக்குமே இருக்குது. வாட் எவர் சாருக்கு சுற்று அவர் டாக்டருக்கு சொன்ன மாதிரி ஹார்ட் லங் மிஷின்லேருந்து எல்லாமே வாட் எவர் ஹி தி பெஸ்ட் குவாலிட்டி மிஷின்ஸ் இன் அவர் ஹாஸ்பிட்டல். அதில் காம்ப்ரமைஸ் கிடையாது. பெஸ்ட் ஹேண்ட்ஸ் மோர் தேன் தி இன்ஸ்ட்ருமெண்ட்ஸ் நிற்குமே பெஸ்ட் ஹேண்ட்ஸ். அதே போல் என்னுடைய இது என்னென்னா நம்ம டீம் வந்து ஒரு ஈகோ இல்லாமல் டாக்டர் சொன்னாங்க டிரான்ஸ்போர்ட் டிபார்ட்மெண்ட்டை கூட சேர்த்துக்கிட்டாங்க. டிரான்ஸ்போர்ட்லேருந்து டாக்டர்ஸ் வரைக்கும் தே ட்ரீட் வெரி வெல். ஸோ அது மாதிரி ஒரு எண்ணம் கொண்டவங்களால தான் செயல்படுத்த முடியும்.